Anna-Kaisa, and this is Life of DI. Hi, I'm back with the 6th episode of Life of DI. I've been pretty busy lately, but I think it's very important to stay in shape, and so tennis is my favorite way to stay in shape, and that's why we're today here at the tennis court. In this video, I would like to talk to you about my 4th clinical core rotation, which was my last as well, and this was at the thoracic surgery, cardiovascular diseases, emergency department, the psychiatric service, and many other kinds of patients that I saw in this service. So it was a nice service from that point of view that I got to see a lot of different kinds of patients, not just one type or a couple of types this time. So I had patients that had renal disease all the way to cystic fibrosis. Mostly I saw patients with heart failure, and my most common thing that I would do would be an heart failure education, which is really a low sodium diet education. And this is really important for these patients because their hearts are having a hard time pumping blood, and if you eat a lot of salt, you're going to accumulate a lot of fluid in your body, which makes your heart, it gives your heart more tough time to pump that blood. So that's why we're going to minimize the salt intake so that the heart will have easier time to pump blood. I also had a lot of heart transplant patients, and their main thing also is an education. Again, because they're going to be on steroids and immunosuppressants for the rest of their lives, food safety is very important, and also just healthy lifestyle in general. A very interesting thing about this service was that there's the psychiatric institute, a part of the service. So when I came into this service, I was pretty nervous how it's going to go when I go talk to these people with some kind of psychiatric illness, like depression or even like suicidal thoughts or attempts in their background. But luckily, it turned out that these people are actually pretty much the same as any other patient. You just have that knowledge in your background, in the back of your mind when you go talk to them, and keep that in mind so that you can approach them in the right way. But at the end, it was really like another person. Nothing different that I had to do with them at the end. So that was very, very nice experience in this service. Also, the preceptor in the service was very knowledgeable. I enjoyed working with him a lot. Anytime I had a question, he could just answer it right then and there. He didn't have to go and look for any resources or anything like that. So I learned a lot from him as well. In this service, I learned, I became a lot faster in my note writing. When I came into the service, I had only 3 notes that I could write every day. But in this service, I got up to 5 or even 6 notes every day, which was really big development for me, and I'm very glad to see that I'm really starting to get where I want to go. I'm very good at building rapport with patients, and I really enjoy talking to them. Educations are actually my favorite part of the patient interaction. But I still have to work on my wording with my documentation. Luckily, that's not a big deal. And also, I had to work with remembering that a patient may have a lot of different things going on with them, and remembering and keeping those together to the end of my approach with them, my intervention with them is important. And I think that with time, I'm really gonna get better at this and remember everything about them when I come up with my intervention. Next one that I have coming up is the pediatric class week. We're going to learn everything about pediatrics, starting from how to interview parents about their children's diets, to coming up with TPN and tube feeding recommendations for small children. After that, I will be spending 4 weeks at ICU, and that's going to be a very interesting experience because these are patients who are much more critical in their illness, and it's very important to have the exact right approach and intervention for them. Thanks for watching, and go and try some tennis, okay? Bye! See you on the tennis court.